of parliamentarians from Nyanza region have cast doubt on the country's readiness to implement universal health coverage 17 days before its official launch. The leaders, led by Seme MP Dr. Nyikal, say most of the facilities in the primary healthcare network do not have enough drugs or personnel, despite being categorized as level 1, 2 or 3 hospitals. Zainab Mohammed with more details.
Community health units.
According to Seme MP Dr. Nyikal, the government should stop politicizing issues on healthcare in order for the implementation of universal health coverage to be conducted successfully.
Already gives the impression that it is there, it is one-off, it is prepared, it is launched, it starts working. Universal health coverage is a process. So what they're going to do on 17th, I presume, is to re-emphasize it, to relaunch the need to move it. But definitely, we cannot say that in this country today, we have every arrangement we need to get the universal health cover.
Nyikal says that most of the facilities in the primary healthcare network do not have enough drugs or personnel, despite being categorized as level 1, 2 or 3 hospitals.
At level 2, 3, 4 and onwards. Some of those levels, we just say they are level 2, level 3, but do they have the facilities? Do they have the staff? Do they have the drug supply that makes them level 2? Many of them have not reached that level. So I presume when we launch, then we will be working more to get that done. But as today, that is not so.
Further, the legislator says key stakeholders such as parliamentarians were not involved in the selection of community health promoters. This is despite the fact that the CHPs will be working directly in their constituents.
Politically, we don't like lack of involvement of stakeholders like members of parliament. It doesn't augur well. But we are not going to castigate what is good for our people merely because we are not involved. We are going to work with the county government, with the partners to get involved in knowing who they are, how they were identified and picked. Because when eventually it doesn't work, it becomes a political problem.
The Nyanza leaders, who were in a consultative meeting with partner organizations to identify gaps in the provision of healthcare at the primary level, say CDF can be used to fund those in dire need of healthcare services but cannot afford to make contributions in the Social Health Insurance Fund. Zainab Mohammed, T47.